So let's talk a little bit about referrals. It's a big deal when you get a referral from a doctor, right? What are the ways to strengthen doctor referrals today?
So, just to make sure we're talking about the same things, in US healthcare and probably other places too, the primary care provider is kind of like the gatekeeper. People go to the primary care provider, the family doctor, and they say they do most of your work. Then all of a sudden one day they're, ooh, I don't know what that is. That looks scary. You should go see a specialist. And so they refer them to a dermatologist, a gastroenterologist, or whatever. So when that happens, the doctor referrals are largely based, clinical competency is assumed. So doctor referrals are based on relationships of trust that are built over time. And so, but there's a lot of factors that can influence who they refer to. And so that's a whole area of expertise most people never think about, which is how to get doctors to refer to your practice. How do they get doctors to, usually general practitioners, how do you get them to refer to your business? And so when we do that, we support those efforts through digital advertising, targeting those doctors. But usually there's people on the ground who that's their job is to build professional referrals. And so they drop into doctors' offices. I don't know if they have this in Mexico, but like we have pharmaceutical reps that'll go to doctors' offices to get them to prescribe. And in the same way, they will drop into doctors' offices to get them to refer to another.
Right. Yeah. I mean, I here you have these different practices, right? But one of them is you go to a generalist that refers you to a specialist, right? A similar system that you explained, and then you have these low cost doctors that are 20 bucks a consult, which is really great when you have the flu or something that it's kind of easy to fix, right? So you can get a prescription and then you can get the generic alternative of the medicine, of the drugs. So
Yeah.
so you get a really low cost of healthcare, right? Because a lot of people don't have a healthcare insurance, right? So that covers. And then you have the payroll healthcare insurance, which is slow, busy. So even people that has that service available, they prefer to go to the cheap generic doctor because it's easy, faster, and whatnot, right? And then in Argentina, we're talking about Argentina before, they have a different system where instead of healthcare insurance, which is, the risk, we manage the risk when you're broke, when you're sick, right?
Yeah.
It's a prepaid medicine where everybody pay and then you get access to all of the services. And then for anything that is non-critical, something that it's optional, right? Then you have a waiting period, right? And then you unlock through the time you unlock it. And then the employer can co-pay 60, 80, 90% of that healthcare system. So I think it's a little bit better because instead of paying when you're broke, business model is committed to make sure that you stay healthy. So they provide, analysis and whatnot because they want to keep you healthy because it's better for the business model for them, right? It's lower the cost for them, right? So it's a
Yeah.
different
We have that in this
mindset, I guess.
called value-based care, but that's much we could talk about that for days. There's a system like that here, but it's
Interesting.
where there was something called the Affordable Care Act, which is known as Obamacare, and it's kind of gone through a whole bunch of. It's a long, 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 long discussion. At the core of that is keep people healthy, they don't get sick, therefore there's less cost. So it exists. It just isn't. But what we call going for patients the traditional way is called fee for service, and that still predominates healthcare. It's much more prevalent in terms of cost, but it grows slowly, the other kind, but it's definitely slow. Yeah.
Right, right. I mean, I think that's it's a whole different philosophical approach to medicine, right?
Yeah.
But I tend to. I mean, coming from Argentina and experiencing here this other system, I kind of prefer the prepaid healthcare because it's. I mean, I haven't experienced myself the Obamacare, and so I
Yeah.
don't know, but this system in Argentina worked great, right? Because it was less friction to get healthy, right?
Yeah. I agree. But here it's so complicated. There's so many people involved, particularly insurance companies. So